today and pay respects to elders past, present and emerging, and to all First Peoples within the land and from wherever they may come. I have two roles in this organisation. One is chair, but also the one advantage I have is also being the chair of the Australian Centre for Value-Based Healthcare. And this came about because a group of people got together from around the world and indicated that one of the things we're really missing is that we don't have really good opportunities to implement. And so this sort of came about because of discussions between a group of people, which I'll talk about a bit later. But we decided it was time that we needed to offer something for Australia. And so this is a culmination of a whole pile of work that a lot of people have done throughout Australia and internationally, as you will hear about later. But firstly, just to talk a bit about the key aims of the centre, what we wanted to do was to increase the knowledge and understanding of the principles of value-based healthcare. We want to build the skills required to successfully implement value-based healthcare, and that's really important because that seems to be where people have problems. We want to also influence public policy to enable that transition to value-based healthcare. We want to focus on outcomes and patient-centred models of care and to support innovative models, funding models. The other important thing is to be able to share best practice examples, both theory and research on value-based healthcare. And so a key element in delivering those aims is education. And the stakeholders that we have highlighted a lack of suitable training in value-based healthcare in Australia for some time. So I'm delighted to be launching this program today. So the Healthcare Transformation Leadership Program is a collaboration program between the Australian Centre for Value-Based Healthcare, the Australian National University and the Value Institute for Healthcare at the University of Texas in Austin. This is the first time an education program has been focused on value-based healthcare and particularly implementation in Australia. The program involves 4 different learning opportunities, including online leadership rounds or tutorials, a 2-day workshop, a facilitated learning sets, and tailored mentoring programs. The program aims to build the skills and knowledge of health service leaders, managers, clinicians and patients to successfully lead and change and deliver high value care in Australia. And I think that's particularly important at this point in our time. So this morning we're going to give you some more information about how the program works and then provide you with some time for your questions. First, we're going to hear from Professor Russell Gruen from the ANU, who will talk about the importance of value-based healthcare and ANU's role in the program. And then I'm delighted to have Professors Elizabeth Teisberg, Scott Wallace and Alice Andrews join us live from Austin in Texas to talk about the interactive leadership rounds. And finally, Alison from Australian Healthcare and Hospitals Association will explain the learning sets, the mentoring component, and talk about the workshop. And Scott Wallace will follow up with more details in relation to that workshop. And then we'll open up the floor for your questions because I'm sure you'll have plenty. So without further ado, I'd like to introduce Professor Russell Gruen, the Dean of the Australian National University College of Health and Medicine. Russ, over to you.
Thanks very much, Deb. I too would like to acknowledge the traditional owners, and also in the face of first bushfires and now the global pandemic, the heroes of the front lines around Australia and the world who are protecting us. And by that I mean not only the health professionals in our clinics and our hospitals, but also those on the public health and policy front lines for who we all owe our sincere thanks. The pandemic has disrupted almost every aspect of our lives, our work, our family, leisure, our sport, travel and opportunities. And we've also seen transformations in healthcare that were almost unimaginable a few months ago. New item numbers in the MBS for teleconsultations, for example, drive-through clinics, harnessing of primary care practices as fever clinics, conversion of our industrial sector to manufacturing PPE like munitions in wartime. And there's an openness in government, and I can speak for Canberra and many of the powerful representative groups at least, to doing things differently. I must say, perhaps this has also shone a light on some of the limitations of the Australian health system in our 2020 society. we see the complexities of the federation in health play out. We're reminded how little a fee-for-service payment system can affect quality of care and patient outcomes. And while we can be proud of many aspects of our health system, we're still often reminded about how fragmented and poorly coordinated it is for many patients. A value-based healthcare framework at its heart is a very simple economic equation: the quality of an envelope of care divided by its cost. An envelope might be for an acute episode like a joint replacement, or the long-term management of a chronic disease. While simple in concept, the devil and the opportunity, and indeed the beauty, comes in the detail. Using holistic measures from the patient's perspective of quality rather than narrow clinical measures, and broad appreciation of the monetary and non-monetary costs borne by the Commonwealth, states and territories, insurers, employers, and of course patients and their families, and you have a much richer view of what value-based care could be and could deliver. Our federal government and our states and territories are already exploring value-based healthcare principles. And already we have some very good examples of systems that support it. For example, in the book that Peter Bragg and I wrote on the Victorian State Trauma System, we described the Transport Accident Commission, a single payer that is responsible for each patient's entire episode of care for as long as care is needed, with individual case managers for every patient. When combined with the political will for a high-performing system and a next generation registry that captured long-term physical and mental health outcomes, work status and dependencies, and health service use, we see an example of a system that has effectively promoted the principles of value-based healthcare and driven service improvements, efficiencies, and patient outcomes. It's a great privilege for us at ANU and in Australia to be able to work with the world leaders in thinking and operationalising value-based healthcare, particularly those from the Value Institute at the University of Texas in Austin. I personally am very excited about this program, very proud to be part of conducting it, and I've encouraged many of my faculty to participate in it and learn for themselves. I'm also grateful for the leadership that the AHHA has shown and continues to show in advancing healthcare in our great country. And I look forward to the rest of today's program and to the rest of the series.
Thank you very much, Russ. I really appreciate that. I'm now going to pass over to Professor Alice Andrews and Elizabeth Teisberg, and maybe Scott, who will come in a bit later as well, to outline the 6 leadership rounds and more detail about that. They are, as you know, realise, are from the Value Institute for Health and Care at the Dell Medical School in Austin, Texas. Welcome to all of you.
Great, thank you, Deb. I'm Alice. I lead the educational programs at the Value Institute for Health and Care. And just to echo Russ's comments about appreciation for healthcare workers, it's Wednesday night at 6:30, and just recently people come out on their balconies in Austin to cheer the healthcare workers every night. They've been doing that. So I'm also really excited about this program. Over the past few years, I've had the opportunity to visit Australia a few times with different members of the Value Institute team to give workshops, to do research. We've actually just written a case study about Dental Health Services Victoria. And I've so enjoyed the people I've met, their hospitality, and I'm also very excited by the work going on across the country to create high-value healthcare systems. So these leadership rounds are a new type of educational program that we designed specifically to help healthcare leaders successfully lead change and deliver high-value healthcare in Australia. While we developed this program with AHHA and ANU before the pandemic, this is a really good format for staying intellectually and socially close in a world of physical distancing. We'll also integrate some of what we're learning about high and low value care from what's happening with COVID-19 across the globe. Elizabeth will say a little more about the content in just a minute. But I wanted to emphasize that the content's built around how to create health systems that are relationship-centered and focused on health outcomes that matter to individuals and to families. Our focus is implementation. How will you use what you learn? The leadership rounds themselves are made up of 6 discussion sessions of 90 minutes each. They'll begin in July and occur approximately monthly. The sessions are organized as a program, so each month will build off of the previous session. They'll also be interactive so that you learn from other participants and build a network that you can draw on even after these sessions have ended. To make that work, each session will include a few hours of advanced pre-work so that the leadership rounds themselves can be used for discussion and for sharing. This pre-work may include videos to watch or readings, and all will include a case study of a real situation where someone has implemented an aspect of high-value healthcare in their organization or in a system. We'll also ask each of you to bring a project from your respective workplace, something to which you can apply the skills that you learned from the session and then share the lessons learned in the next session. So we encourage you to sign up with others from your organization so that you can work together on the projects as you go through the program. We look forward to learning about your projects and really to getting to know you over the course of these sessions. So I'm going to turn over to Elizabeth to talk a little bit more about the content.
Thank you, Alice. Alice, your leadership of educational programs is always inspirational. I'm Elizabeth Teisberg. I'm the Executive Director of the Value Institute for Health and Care. And I will echo Alice's sentiment that the partnership and colleagueship that we have been developing in Australia has been really exciting. It is intellectually exciting. It is fun. It has already seeded deep friendships. This slide shows you the topics and the dates for each of the leadership rounds in this program. As a set, they provide a solid how-to introduction for implementing high-value healthcare. Many of the steps to transformation are being accelerated by the pandemic, as it raises the urgency for healthcare to achieve better results, to serve everyone, and to honor the importance of relationships in our health and our work. The first session will be on implementing high-value healthcare. We begin with the aspiration of achieving better health with the people we serve. We'll discuss how an organization resets its shared aspiration. The purpose of healthcare is to improve the health outcomes of the person and the family being served. We'll discuss how can we organize for this goal, measure what matters, and enable patients to succeed in the care of teams. What does it look like to have relationship-centered services that provide better results, meaning better value for patients and families? In the second session, we'll look at a primary care organization and discuss how understanding the shared needs of patients with similar medical conditions can help us develop high-value solutions for care and for life. You'll learn about the experience group methodology, where patients share their experiences with their illness and their lives to help us learn about the outcomes that are important for them. The third session will focus specifically on measurement. We will discuss an example where measurement enabled significant improvement for patients, as well as support for the professionalism of clinicians. You'll learn the capability, comfort, and calm framework to measure outcomes that matter to patients and create clinical improvement that accelerates this change. Our focus on value creation is primarily the outcomes for patients, but we also need to look at the denominator, or how we spend the limited health dollars to achieve those outcomes. So our fourth session will be used to consider how different approaches and assumptions about cost measurement affect managerial priorities. We'll look at the relationship between healthcare delivery and cost and how to use this information for strategic decision making. We can make all the right decisions, measure all the right outcomes, and design the best systems, but if we can't bring people along with us, we won't see any transformation. So session 5 looks at how we can enable multidisciplinary teams to rock. We'll look at building strong relationships and using effective communication to achieve the shared goals. We will discuss how to create effective teams and how to lead from wherever you sit within the health system. And then the last session will be on strategy for high-value healthcare. The goal of high-value healthcare is to enable better health outcomes for all without driving up spending. Our final session will look at how we can scale successful pilots to serve more people throughout the population. You will analyze opportunities for expansion across your own health service system or region. So we'll cover a lot of ground in 6 sessions with a lot of interactive discussion among the group so that we have more opportunity to get to know you, your challenges and your successes, and we can help you share those across your groups.
Thank you very much, Alice and Elizabeth. And having been participants in some of the workshops that you have run before, I know that you learn as much from the other participants as from yourselves. And that's one of the things that you really accentuate in the training, which is really good. I'm now going to pass to the CEO of AHHA, Alison Verhoeven, who's going to give some rundown on the learning sets, the mentoring program, and introduce the workshop that's going to be held in Perth in 2021. After that, Scott is going to talk about the detail on the workshop, but I'll introduce him later. Thank you. Alison.
Thanks, Deb, and hello all. So as you've heard this morning, it's a very exciting program that's been designed through the leadership rounds. But one of the things that we wanted to do to support leaders who are implementing value-based healthcare programs in Australia was to provide an opportunity for ongoing networking with peers. And the way we propose to do that is through learning sets. Learning sets are you're probably familiar with those. They're quite well used in the Australian health system. Many health leaders participate in them, but these ones will be particularly focused on value-based healthcare. They'll include expert guest speakers, including some of those who are participating today in today's webinar, but also others who've got practical experience about some of the challenges and also the opportunities for implementing value-based healthcare in Australia. They will be very much in the Australian context, and the aim is to complement, not to replace, but to complement the interactive leadership rounds that you've just heard about. And Anna, I might ask you to move to the next slide on mentoring. In addition to the learning sets, we're also offering a tailored mentoring program, and essentially this can be designed around your particular needs. We anticipate this as being provided by an expert panel of mentors, including from the Australian National University, Australian health leaders, from within the AHHA cohort, and also from the University of Texas. And what we're anticipating with this program is that you will come to us with a particular need that you would like support with, and we will help you match you with the right mentor, the person who's got the best experience and the best credentials to support you in implementing your program. And we're happy to discuss what that might look like and the timing of it. Obviously, the learning sets are going to be influenced a little bit by the timing by which Australia opens up again to more travel and opportunities to work together. And we will tailor the learning sets initially to take into account some of the restrictions related to COVID-19. But we are happy to work with you and to try and determine something that really fits your needs. So that's really the focus of the learning sets and the tailored mentoring program. Lastly, in this package of learning opportunities, we're going to be hosting a particular workshop on value-based healthcare at a national value-based healthcare conference in Perth in March 2021. And this workshop will be presented in partnership with the Value Institute. It's supported by the Australian National University and will focus on measuring outcomes that matter. Scott, could I ask you perhaps to talk a little bit about the content of the workshop, please?
That one gets me about 6 times a day anymore to forget to hit the mute. Thanks, Alison. It's an honor to get to join you. We have all really enjoyed the opportunity to work with AHHA, with Australian National University, and with the folks in the dental program in Victoria. In this particular 2-day program, we've designed an in-person workshop for Perth that will build really intensely on what you learned in the leadership rounds. There is a value to bringing people together, to having more time to talk, and to diving deeper into those topics. It will take a deep dive into how to measure the outcomes that matter most to patients and how to design, to deploy, and to scale high-value services. And we have delivered these all over the world. We're really customizing this one around the learning sets so that we can build out for the people who have participated up to that point.
Excellent. Thank you very much. We now at a stage where we can answer questions from the participants. And I've got one question here that I will read out, and then I might throw it to Elizabeth to potentially answer, or Alice, it could be. But the question is, Alice mentioned that each session has a case study. How will these be adapted to be relevant to the Australian context, e.g. universal healthcare, different funding models, split accountability between primary and hospital-based care, etc. And I know that we've been doing a lot of talking about that, so I might throw firstly to Elizabeth or Alice, and then maybe Russell might like to say something as well. Elizabeth.
So one of the cases we're doing is set in Australia, so it won't need any adaptation. And 1 or 2 of the other cases are set in Europe, so they would need adaptation, and then there will be probably 2 set in the US. So we will adapt as necessary. What we have found worldwide and in our previous work in Australia is that many of the challenges around care delivery are widely shared. And it's when we're talking about payment issues where we tend to need the specific adaptation.
I think it's fascinating. Every place that we go, the desire is for a case that took place in that town. And the reality is that the problems that are in healthcare are strangely ubiquitous. And they're really not dependent on the language that's spoken, on the customs of the country, or even really on the payment system. We have found the same problems in systems that have single payer systems and systems that are as weirdly dysfunctional as the US is. It's a little bit of that phrasing about, families are all crazy in the same ways.
I would just add that, in putting this together, we've tried to be very deliberate about what we think will be helpful from the conversations we've had with Alison and Deb and Russ and others, so that we are making sure that we're tailoring the content directly to what's applicable in Australia.
Russell?
And I'd add that, that actually, rather than being a disadvantage, it's an advantage to see what's happening in other countries. We are in Australia used to a federated system where there are different payers for primary care and for hospital services and emergency services and community services and so on. And the value of actually seeing what a single payer can do and how it might work, I think has opened my mind to understanding what's possible. And to see examples of it in Australia, like Dental Health Service Victoria or the Transport Accident Commission, has shown that those principles are implementable in Australia. So I actually see it as a great strength of the course that we're actually able to study in detail how other architects have designed other systems and what the effects of that has been.
Yeah, it's great, Russell. I've done a lot of work in Canada, and Canada supposedly has a single payer system. And yet every single time that I've been there working with people, I've observed not fewer than 12 different payers that affect the care of patients. So the accents are different. The issues are really, really similar.
Yeah. That's okay. And certainly in my experience of talking to people from around the world too, is that we've all got slightly different versions of the same problem, and but the solutions often can be applied, are very applicable in the Australian environment too, which is good. I might throw this next question to Alison. It's just checking the cost of the webinars, $3,960 per person for all 6.
Yep. It's actually $4,000 plus GST for all 6, and there is a discounted opportunity for AHHA and ANU members and alumni, and we're happy also to discuss discounted arrangements for group registrations as well.
Okay. The next question.
Point out that the discount for AHHA and ANU is because we've put in a chunk of cash to start with.
That's right, exactly. All the more reason to either sign up for an ANU course or join AHHA.
Exactly. Nothing like cross-marketing here. The other thing, next question is, would we be able to expand on the target audience for this program? Alison, I'm not quite sure whether we are targeting particularly people in the healthcare system that are implementing change in the environment, but I don't think we've really got restrictions significantly on the audience, have we?
No, we don't have any restrictions on the audience, and we're really focusing not only on clinicians and health service leaders who are implementing program, but also on policymakers, because this is an opportunity, and one of the first opportunities we've had in Australia, to really have a program which focuses both on the intellectual content around value-based healthcare and then the tools to implement. So really it's just as applicable for policymakers and for those interested in the way the system works as it is for those who are implementing in their actual health service. We welcome you all. We also welcome patients and consumers because they are key to the success of value-based care programs, and we really think it's very important for patients that participate in the consumer panels that support value-based healthcare programs to be upskilled and have the knowledge of the goals that are trying to be achieved in those programs too.
There is another question here about getting subsidisation for participation in the program. And particularly whether we've had any conversations with states or Commonwealth government in relation to support for this. And I'll throw back to you, Alison, but my understanding is they're very aware of this, very supportive of this, but whether that goes as far as paying for subsidisation of the program, I'm not sure. Alison?
We've certainly been in discussion with state health departments, and there are a number of state health department representatives who are on the line today who are participating in the webinar. So they're very aware of what we are offering here, and we're very happy to work with the departments to put together packages that might support their staff. Likewise with the Commonwealth, but obviously we can't promise that, but we're certainly very happy to work with those departments.
Could I just add, Deb, that in the programs that we've done, we find that one of the most powerful things is when a group of people with different roles from the same organization do this together, administrators, clinicians, whomever is part of that team. That's what tends to lead to the strongest transformation as people develop a language, a common language to work together.
Yeah. And I actually think that my experience of talking to countries that have really implemented it at scale, that's very much the case, where they've got, you talk to the chief finance officer and they can speak the same language as the clinicians, and the patients speak the same language, and that's when you really know that you're going to really rock, I think, as Elizabeth says. Does anybody else have any other questions they'd like to ask? Otherwise, we might. I mean, I've got a few more here. I've just lost it. Just hold it for a moment. There's a question about is there any credit towards courses at the University of Texas or ANU. I think at this stage there's a certificate of participation, but it's a watch this space, I hope. Alison or Russell or Elizabeth, would you like to answer this one?
So at this stage, it's a certificate of participation, which will be co-branded by AHHA, the ANU and the Value Institute. There's also opportunities to apply for continuing professional development arrangements with your various professional colleges, and we've certainly structured some of the learning such that it meets those requirements. So we've anticipated, for example, some self-reflective opportunities to support CPD applications, and we're certainly happy to discuss that further with the various colleges to look to see how we can make that a more formalised part of the CPD programs.
Okay. And I think there's some other questions that sort of, I think Alison's basically covered off on that. There's another question in relation to what resources would you recommend to support convincing health service leaders to get on board? I'm going to throw that one to maybe Alison first, then to Russell.
Okay, thank you. Well, I guess firstly, I would be suggesting if you're working in a hospital or one of our state government health departments, your state government health department has signed up to the National Health Agreement, which is being implemented from the 1st of July. That 5-year agreement specifically has requirements in clause 7 around value-based healthcare. So I would be pointing to that and saying, here is the rationale for us as an organisation and for me as an employee to be upskilling in value-based healthcare, because it's part of our national health architecture. If you're working in a primary health network or in the primary health space, you will be aware that over the last 3 to 5 years, significant work has been implemented across the country on commissioning health services, commissioning for outcomes. Value-based healthcare is absolutely key to successful implementation of commissioning programs. The things that you will learn in these leadership rounds, in the workshop in Perth in March 2021 at the Value-Based Healthcare Conference, and through the learning sets and the tailored mentoring, absolutely align with the principles of funding that are being put in place by the Australian Government in partnership with the states and territories. Russ, would you like to add to that?
I'll just add a perspective from ANU, which is a university that's legislated to support the nation by advancing policy and practice innovations that affect all Australians. We interpret that as a responsibility to work with local providers, other academic institutions and health services to assist them with the resources and the expertise and to develop that expertise locally. So I'd be keen to have conversations with participants throughout this course about how we might set up conversations in your own health service, how we might partner with local state-run universities in advancing the mission of value-based healthcare and doing some implementation work that actually affects people on the floor.
Thank you. And just a final question is, would the program take into account and consider mandatory accreditation requirements? I'm not sure whether you're talking about accreditation with respect to education or with safety, but I think you could be rest assured that the answer would be yes, particularly from the safety perspective, but certainly from the education perspective, particularly if we can move it towards some sort of credit towards other university courses. Does anybody want to add to that, Alison?
Yes, I'm happy to add to that, Deborah. And I saw who put forward that question, so I'm assuming that it's probably around safety and quality. So one of the things I would point out is that the Commission on Safety and Quality in Healthcare in Australia is very conscious of the work that's happening around value-based healthcare, and is certainly working on outcome measures. For example, putting together, it has a resource bank now of patient-reported outcome measures, and it sees this as a component of safety and quality. The Safety and Quality Commission also have a representative on the advisory group for the Australian Centre for Value-Based Healthcare, and are very well aware of the work that we're doing in this space. We are equally conscious of the work that they are doing around safety and quality, and that will absolutely be part of the lens that is applied in this.
Okay. Thank you. Well, I think we're at the stage of finishing off. I've got no more questions to be answered. What I would like to do is to really encourage people to participate in the programs, and we'll just put up the last slide if that's possible, Anna. But it's really important to recognise that all you have to do is to ring through, and we can have discussions with you at AHHA. But I'd also encourage you to just have some initial discussions about what do you think would be something that you would really value, and what do you need, and we can help tailor for that. So on that note, I'd just like to thank you very much for attending. I'd like to thank Professors Teisberg, Wallace, Andrews and Gruen, and also to thank Alison and Anna for their contributions today. I think this is a really exciting opportunity, and I'm looking forward to working with you all over the next years. Thank you very much.
Thank you.
Thank you. Bye.
Thank you.
Great to see you too.
Yeah.
Yeah, you as well, Russell.
Yeah.